Ian, I'm going to turn to you as an expert in neurology. I want to have you talk about what we have learned about the plasticity of the brain. How can we make it more resilient during the course of our lives? Is it not a fixed thing, the brain?
So we've been very lucky, George, in the last 30 years to move from the situation where there was just an idea of a fixed brain, a certain number of cells that you were born with. And when I was a medical student, you had to keep them and you lost them. And there were two big ideas. One was the genetic idea in childhood. The childhood was just determined by your genetics, the brain just grew. And then inevitably, you lost capacity as you aged. Both of these are wrong. And so what we've learnt through being able to image the brain and follow the brain in life is the extent to which it changes. The connections between nerve cells, the synapses in childhood, are driven by socialisation, by good health, by education, by activity, by physical activity, by good sleep-wake cycles to actually make the brain work and develop most effectively its greatest capacity. Then you need to keep that capacity through life, as Mia was just describing, by being active. And I would make a big emphasis in our own research on sleep and circadian research every day. It's a 24-hour cycle. Your brain is doing different things when you're awake. It's then consolidating each evening through memory and exercise. You must maintain that. And then as you get into the sort of age we're in, George, never retire. You must stay active. You must stay socially engaged. Mia and I was just discussing, you must keep dancing. You must stay connected. And then what we know is we can see the brain now maintain the connections. And what's really interesting, you can see when people stop. They might stop, as the French did in their mid-50s, and they start to lose their capacities. Or in many of our societies in the 60s, the French shouldn't be protesting about this. They should all go back to work and stay active. And then in our societies, there's a really big cultural bias against the elderly when they have so much to contribute. The transgenerational aspects for grandparents and taking care of kids and staying engaged and being included for their wisdom, for their capacity. What you see at the individual level is synaptic connections maintained. The brain is active and responding in real life. It does not inevitably deteriorate with age. It may be slightly slower to get the right answer, but often older people get the right answer better. It just takes a little longer. They're not actually losing that capacity. And many of our tests, neuropsychological tests, which are time dependent, are very unfair to older people. Actually, the complexity of what they do, the consolidation of memory, the recall and the problem-solving capacity they have do not inevitably deteriorate with age. And so what Mia was emphasising is we need to know this every day. You need to be working on it every day, to be socialising, to be physically active, maintaining your health. And if you do so, maintain that social connection being one of the most important aspects. And I would emphasise transgenerationally in our cultures, which have had such a bias against older people, that we must maintain that. And now we can see in brain imaging, we can see in life the individual benefit that derives from that and the potential to prevent cognitive decline.
What's so remarkable is you're telling me that this plasticity or this ability to create new synapses is not age dependent. We can
not.
do this in older age.
There are so many myths, they're wrong facts, they're kind of alternative wrong ideas that were based on being able to collect the brain after death, largely in people who were sick. Now we can record the brain in life, largely in older people who are healthy, and they are making new connections, but it depends on interaction with the environment. Every day, those connections are driven by what you're doing, physical activity, social interaction, mental stimulation as you age, being engaged, being active, and I would say being socially engaged, interacting, seeing people's faces, interacting with groups. And that's where our societies, Western societies in particular, have often militated against older people who are more restricted musculoskeletally or by other problems and become isolated. That's when their brain capacity is most at risk.
Let me ask you, because we're working in India through DAC, and there obviously is a greater emphasis there on meditation and spiritual aspects of life, and whether or not that is a useful thing to reduce stressors or the consequence of stress.
Yes, quite clearly. And I think we're very grateful in all those cultures. The emphasis has been put on not just meditation, but also yoga, physical movement. You see this in Chinese cultures, in other Asian cultures, movement as you age, along with the relaxation I think Mia was emphasising. So meditation isn't always just doing nothing. You can actually be doing physical movement or engaging in mindfulness to reduce the degree of stress, because stress hormones, when they're overemphasised every day, one day to the next, have adverse effects, harm synaptic connection. Actually, the brain has to relax from those things, which normally increase its attention during the day, which is why your sleep-wake cycle is so important. Again, older people change slightly the timing of their sleep, but they need to sleep, and that's driven by physical activity, sunlight exposure, being active during the day. So we have to support also things like the musculoskeletal health of older people so that they can engage, or use new technology so they can stay engaged with their children, with their grandchildren, with their social groups in ways that we now have opportunities. It's interesting what you say about developing countries. I've been visiting a number of developing countries on the way here. The transgenerational aspects, just saying with Mia, men out dancing at any age, social groups across generations dancing together, being physical together, not excluding older people simply because they're old, but actually making it really good. And we have good evidence that's good for the cognitive function of older people, and it's very good for the cognitive function of their grandchildren.
Well, let's go dancing tonight, Ian.
Yes.
I'm up for it. Come on.